at Yale University School of Medicine. Welcome. And we were going to be joined by Irene Chen from Berkeley, but she has not been able to make it. So first question, biggest question, generative AI, which, as everyone knows, is this new wave of AI that includes ChatGPT, Gemini, Claude, GPT-4, and other large language models, has the potential to revolutionize healthcare. And it's already being used to help prevent disease, to improve cancer diagnoses, manage medical records, and much more. So, Lucila, let's start with you. What are some of the most promising applications of AI in healthcare, and particularly public health?
I think translation is impressive into so many languages, and you keep testing it, and it keeps getting better and better. I think communication in general, and again, with the attention to when generative AI should be used versus other classifying AI, for example.
Great. Andy?
So I think one thing that has struck me over the past 5 years is I've constantly unable to predict where this is going to be useful. And I think that if you had asked me 5 years ago, I would have said medical knowledge and diagnosis, these things are going to be book smart. But what we're starting to see in the literature is evidence that they're also empathetic.
Yeah.
And so there's a lot of papers published where if you rate the empathy of a note written by a human doctor versus an AI, people rate the AI's notes better in terms of empathy.
Yeah.
So that for me has been a big surprise. And I wouldn't want to hazard a guess for what I'm going to be surprised by next. But again, I think that improving patient care and improving empathy in the healthcare system has been something that I found both surprising but also promising.
Yeah, you wouldn't have seen that coming. Yeah. Milind?
I wanted to go in the direction of mobile health or mHealth programs. I feel AI has a tremendous potential. I mean, if we think about tuberculosis prevention or diabetes prevention, maternal and child health, mental health, in all of these cases, wherever there is this mobile health programs, diagnosing patient or beneficiaries' health status, doing some kind of live intervention. These are the types of things where AI is very promising, has been used. I wanted to, if I may, just very briefly talk about my own personal experience here. We've been working with a nonprofit in India called Arman, which has mobile health programs where every week they deliver an automated health message to moms when they're expecting or newborn, from the time the mother registers to the baby being 1 year old. So these are messages about taking iron, calcium, etc. But 200,000 mothers register, 30 to 40% mothers drop out of the program. They can intervene on 1,000 of these mothers, say, per week. The question is which 1,000? AI can help prioritize, rank, so that they can intervene on the right 1,000 mothers. And we have shown that these AI interventions are more effective than doing random interventions, for example. So these kinds of things where AI can fit into the normal workflow of an organization, I feel is very promising.
And reach anyone who has a mobile phone.
That's right.
Yeah.
That's right.
Okay. All right. So that was the bright side. Now let's go to the dark side. Lucila, back to you again. What's your greatest concern?
Improper use of the technology. The technology itself is amazing, and it's going to do great things. Now, if you don't know how to use it, then you end up using generative AI for tests that are not supposed to be generative, or you use different kinds of classifiers trained on biased samples, and you produce answers that perpetuate that bias.
So is there one most striking example of a wrong use of using generative AI for something that you really shouldn't use Gen AI for?
Well, in terms of diagnosis, for example, if you're thinking about getting some hypothesis generation and add to what you're already thinking, I think it's a great use. It generates a new hypothesis. If you're trusting solely the AI to do the diagnosis and prescribe what to do, I think we're not there yet.
Andy?
So I'm going to attempt not to violate the brevity instructions that I've been given. But
you each get one long one.
Okay, this requires a little setup. So I think it's worth pointing out that when we say generative AI or AI generally, 99% of the time we mean ChatGPT. So we're kind of living in this monolithic age of one AI that we talk about what can we use ChatGPT for. And that has several pros and cons. the cons are that it's a one company, consolidation of power, but the pros are actually it's very easy to gate access to one model for certain purposes. So if I want to use ChatGPT for nefarious purposes like misinformation, OpenAI can look at the things that I'm sending and say, we're not going to allow that. However, there's actually thousands of generative models right now, and they're open source, and they're not gated. And so I'm a big open source proponent, but what I think a real near-term risk is misinformation. And so we now have open source models that are as powerful as GPT-4, the model behind ChatGPT. And so there are essentially no safeguards or no rails that would stop someone, a bad actor, from using that to spread misinformation. And so I think a big concern I have, specifically for public health, is the sort of misinformation at a huge scale. We've had that already, and so like
We didn't need
misinformation,
AI for that.
like there are Russian troll farms and like low quality bots. I think it gets harder though when you can do this at scale in a way that's indistinguishable from a well-informed person. And so you're going to be talking to someone on the internet and have very little ability to know if this is a real person or if this is an LLM that has been trained to try and trick you or believe something that is false. So I think that's something in public health specifically we're going to have to be proactive about and think about what potential solutions might be.
So my only pushback there is we don't seem to be seeing much of that yet, right?
Yeah, well, maybe. I mean, it's hard to measure.
know.
Like, how would we know? I mean, I think that there's estimates of misinformation on Twitter. I think it's hard to know to source the misinformation, and these tools are still new. And so I think that as the cost to run them comes down, there was a model released by Microsoft that's extremely capable that can now run on your phone. And so there used to be a compute barrier that you had to cross to be able to do this, and it probably wasn't cost efficient if you have to pay Amazon $10,000 a month to run your misinformation farm. Those costs are going to come down because they're subject to Moore's law, and so I think it's going to be cheap and trivial to operationalize these things. Maybe we haven't gotten there yet, but it seems inevitable to me that these models are going to be used in that way.
Melinda, Lucila, do you share that concern?
I do share all of the concerns that were raised earlier, but I wanted to also raise another point about concern I have, which is when we reward people, especially in AI, I come from AI, on the technical brilliance of their solution, then there's a danger that we pretty much follow a solution-focused approach to a problem. So it doesn't matter what the problem is. We have, there's some new technology, and it's going to get used no matter what. And this is one instance of that's being raised here. That maybe, for a particular problem, a generative AI solution, whatever, may not be appropriate, but because that's what the reward system is set up for. Say, for example, from a research side, that's what gets proposed. And so I would say a danger is not having enough humility, perhaps on the AI side, towards the actual real-world problems, and not taking a problem-focused approach, but rather a solution-focused approach to try and propose solutions for problems that don't quite match. And I've seen examples of that. Probably I shouldn't mention them here, but
Well, give us a general example. Of
so for example, a solution to use a radiology tool, say for example, ultrasound, where in some countries maybe this type of ultrasound is not allowed for gender discrimination or things like that, for fetal discrimination and so forth. So it's a complicated situation, and things have to be very carefully done.
So I think a lot of people are feeling like we have this amazing new hammer, and now we're going to look for nails, right? And not all of the nails are necessarily the ones that you should use. Yes. So I think we should jump from that question to the question of regulation, because particularly in terms of misinformation, you might want to apply regulation to try to reduce that problem. So Lucila, how should generative AI be regulated? We've just seen the EU do the first big plan for that. What's your opinion?
The use cases need to be regulated, right? If you impersonate someone else and start pretending you are someone else, that is a problem. But that's a use of AI and not the AI itself, that it can generate a deep fake of somebody isn't technology, conquer. So if you are the person you want to generate for yourself, that I think AI is awesome, is perfect. And we talked about you wake up, you're not ready for a video, but AI is ready for you.
You just have your avatar do the whole video.
So you don't need to regulate the technology itself. You need to regulate how it's used.
Andy?
I think two ways to think about this. One is if it's a medical device, we have something called the FDA that knows how to regulate medical devices. Just because you have AI on it doesn't mean that it should go through any other pathway. And indeed, there have been a lot of FDA approvals for AI-powered medical devices. So if you look like a medical device and sound like a medical device, go to the FDA. The second is kind of what was said earlier, is that there needs to maybe not be regulation, but auditing. And so there is this group called CHI that is essentially setting up, if you're familiar with wet labs, like a CLIA-like certification process for AI processes. So we're not going to tell you what you can and can't do with it, but we're going to certify a set of best practices and then tell you whether or not a given model adheres to these best practices, so that as a consumer you can make an informed choice. So I think especially for big tech companies, as we've moved into this sort of era of closed source, over the last 10 years, everything was open source and we could read the code. We're definitely, given the sort of value proposition that these models have moved into the era of closed source. There has to be some type of disinterested third body, that can at least audit and tell us what's in there, what was used to train the model. Was it trained on 4chan or was it trained on like the New England Journal? Like those are things that we need to know. And I think I would really think of those things that aren't medical devices more in the auditing category, and we need to have procedures and mechanisms to do sensible auditing.
William, is there anything you want to say on that one? Or
We can move on. I think they've covered it.
although
really
actually,
well.
the question for you would be, is there any sort of regulation that you think would be optimal for the greatest social good?
That's a tough one. I can talk a little bit more about. I feel on the one side, yes, there is sort of top-down, if you will, regulation, but there's also somehow training that we need to
for
give
everyone?
for students, it was AI, people who are interested in AI. So complementing what they have been saying in terms of regulating uses of AI, maybe directing, motivating applications of AI towards the types of social good that we want. And so from that perspective, what's happening today is that we expose AI students, again speaking as an AI researcher, to methodological advances in AI, the latest methodological work, and then expect them to, now go out and apply your knowledge to global challenges, global health, things of that nature. And it doesn't work like that because they don't have adequate training, they don't understand where to look for exactly the right kinds of problems, the applications of being responsible in AI applications, things that are known in public health, that sort of implementation science, things like that, how to form partnerships with community organizations and working with them. So these are things that AI students would need to learn. And on the one hand, it seems like when my class on AI for social good is highly, highly oversubscribed. When I talk to younger researcher students, it just seems like there's so much interest in AI for social good, in AI for global health and so forth. But where do you start? And how, you don't have the right training. And so I guess I can speak a lot about this, so I'm going to stop here.
Thank you. I didn't even signal you.
I just wonder, so I went, my PhD was supported by the NIH. I had required ethics training, so I learned about Henrietta Lacks and the Tuskegee experiment, and ethical training was a part of my PhD. And I wonder if you think there should be similar requirements for folks who are explicitly studying AI. I think Henrietta Lacks is actually a very good use case, because if you're reusing some patient's data without their consent, there seems to be an analogy there. Is that kind of like what you were getting at? So,
when I learned AI, late 1980s and so forth, it was just like, here's a bunch of papers that you read from, and other computer scientists in my department, PhD students, would tell me that AI is basically BS. Really, you learn real computer science. This is nonsense. Yeah. In some sense, especially when it comes to AI for social impact and so on and so forth, we are in a similar state. Read some papers, but the kinds of training that is a rigorous training, maybe that is really needed. We don't know what really to train students with, And so this is just like, I'm hopeful though, just like with AI, eventually we got textbooks. Today I think it would be hard for other computer scientists to come in. I mean, it would be real difficult to say that, well, you're not learning anything. But it took some time to get there. And I think we are in a similar state here, where we need that kind of, and that wouldn't come just from AI itself. I mean, AI borrowed heavily from all sorts of other disciplines to become AI. And similarly, AI for social good has to borrow from all sorts of other disciplines, from public health, social work, to really become this kind of a discipline that we want it to be.
And the potential uses for generative AI are so different and so new from what the past iterations were, right? That it's it's a whole new intersection.
Right.
Yeah.
Yeah, I think in a way, training, you can never anticipate everything, but any new technology requires a bit of training, and definitely the ethics principles, social implications all apply.
Okay, let's shift gears a little bit into the medical field. So we are facing a shortage of providers, even here in Boston, and it's estimated that about half the global population lacks access to appropriate healthcare at all. How could AI help fill that gap? Lucila, do you want to start?
Yeah, I think for the simplest cases in which you don't have access and you want them resolved quickly, I think it will do well with those cases. But I must say, expertise is not dead. There is a need for it all across medicine and across public health and so on. So I think what will happen is expertise will be more valued than before.
Interesting. Andy?
I guess I'm speaking in twos here. I think there's two ways to think about this one also. I think that if you're comparing it to someone who has access to no medical expertise, this is an obvious use case for that. If you live in rural parts of the country and your nearest physician is 3 hours away, you can at least get access to a facsimile of that quickly, cheaply, and easily. So again, I think increasing access to expert medical knowledge is one. And then at the other end, folks who have been on a multi-year or multi-decade diagnostic odyssey who still have no answers. There's been a lot of compelling use cases where moms late at night after receiving their 17th doctor puts in their child's medical records and it comes up with the correct diagnosis. So again, like if you're kind of at the end of you've been on a challenging diagnostic odyssey, this is good for like a cheap, easy, and quick 18th opinion in this case, And so I think both of those use cases are things that I'm excited about.
I guess for me, partnerships with organizations in order to understand where AI can bring in efficiencies, but not in a way which eliminates the human touch where it's absolutely needed. So if you think about increasing uptake of vaccinations, for example, in terms of global health, then where exactly might the interventions be more useful? So who should get vouchers to travel? Who should get actual transportation? Who should get a reminder? From past data, machine learning tools can be more precise in terms of figuring out where these interventions would be most effective. Or if we are thinking about spreading, particular health information, so who would be the right kinds of influencers to spread this sort of peer leaders? So AI can be useful, but I certainly wouldn't want it to be used in a way where, as Lucila hinted, to eliminate expertise when it's truly needed. But much more, I think, the need for real partnership, real problem-focused thinking, and inserting AI perhaps in the normal workflow of an organization.
Augmenting
rather than,
And I have an addition to it. I think it's our responsibility also to apply the same evaluation methods that we use for all other technologies. So for every one case in which it finally discovered the right diagnosis, we should also measure in the ones in which it didn't. And then do a comparison. So I think it's our obligation to, again, study in more detail because it's a huge societal responsibility.
Yes. And one follow-up just for Andy, what about mental health care? I mean, this is probably the biggest shortage of all is therapists, and yet it's also one of the areas where it's kind of most daunting that you would have an AI.
Again, this to me sounds like an access issue because like in large parts of the country, access to mental health care is non-existent. So I do think diagnosing traditional like mental health issues like depression, anxiety, things like that, it can be good for that. I'm a little nervous on some of the mental health use cases because if it goes badly, it can go very badly. But again, there's a broad spectrum of mental health and psychiatric conditions where this can be helpful. For example, your average person with type 1 bipolar disorder is undiagnosed for 7 years. And if you've ever met someone who has type 1 bipolar disorder, that can be a very, very rocky 7-year period. And a lot of times things like that manifest to the family as substance abuse and things like that, and there's just no clear indication of what's going on. And again, if you had access to a ChatGPT, that may be able to shorten those types of like diagnostic odysseys and really improve the quality of someone who has a condition like that.
Interesting. Let's talk about bias. So some researchers have raised concern that AI does not account for algorithmic bias and could exacerbate health disparities. How can these biases be addressed? Lucila or Melinda?
Well, again, we know all of this have training sets. And we know that training sets can be biased themselves, not representative of the population that will be using or on which those models will be used. There are also issues with the algorithm itself that you can try to tweak and minimize a little bit of that, but there is no substitute for having high quality training data and very good and quality construction of models.
I guess just one comment is that often what models do is operationalize bias. And so there is bias inherent in the healthcare system that's codified in the data, and what they are doing is automating and operationalizing that. And so, I always tell my students, like when you're operating in this sort of machine learning for healthcare and public space, you're operating at the edges of a technical problem and a structural societal problem. And oftentimes bias is a structural problem that has been codified in the data. And so it becomes more like a societal thing that we need to fix. Collecting representative data, as it was said, and just making sure that we are teaching our models what we actually want them to learn versus sort of what's coded in the data.
So is there in fact hope that AI could detect and correct bias more than society has been doing?
I think I can point to one paper from Emma Pearson and Ziad Obermeyer where they showed that Black Americans experience knee pain at higher rates than white Americans, and radiologists have typically ignored this or sort of written it off, but they actually trained a model to predict patient-reported scores, pain scores, instead of what the doctor wrote. And so they were actually able to explain some of that unexplained pain score in knee pain that had eluded sort of human physicians for a long time. So I think if you're very thoughtful and very intentional, there are chances to sort of reduce bias in some cases when you ask the right question. Because again, the question they were asking is, can I predict the patient's reported pain instead of what the doctor's impression of the knee was?
That's interesting. Okay.
Can I say, the data I mentioned as one of the problems, but it's not the only problem. The way you use the models is a problem too. There were some models to optimize scheduling that would overbook certain populations, but not others. And that's out of the data showing that there are more no-shows in certain populations, but it's a biased model.
Yeah, it's interesting. So we're near the end of our live stream. I'd like to ask each of you to wax a little bit imaginative here and paint a picture of where this all could be going. I mean, it's incredibly hard to predict exactly where it's going. The future is basically randomized. We don't know what GPT-5 is going to look like. We don't know what's going to happen next year. But nonetheless, let's say a few years from now, could you paint a picture of the practice of medicine and public health in the generative AI era? Lillian.
So from a AI perspective, what's very exciting is the ability of these models to actually generate code. And so today what's happening, I gave examples, this maternal and child health application that we built. And we've built similar applications with nonprofit in Africa, to others for, say, tuberculosis, medical adherence, and so forth. In each case, it's some government agency or nonprofit that we talk to, extensive conversation, then we go in there and we will build the model, and so it's a very ML engineer focused, labor intensive process. What I'm very excited about is the possibility of a natural language, a English description or whatever language description of the problem, and using these generative models to automatically be able to generate the AI model, the code that is necessary to execute the vision.
So anyone can do it.
Anyone can do it. So rather than, at least simplify the whole process. Today, if it takes a long time for us to go in there and actually build the model and all of that, could imagine that this becomes vastly speeded up. If the minor modifications needed, prioritize, in your resource allocation, people of low income or low education, that these kinds of things are automatically taken care of, so that the needs of if a government agency or a nonprofit struggling in a low resource setting are things that they can just express and allow particularly these AI models to automatically get configured. So this is something that is beginning to happen. We are not there yet, but like you said, if you're thinking about what makes me hopeful about the future, this is very exciting in terms of empowering these agencies to be able to vastly speed up the process of generating these kinds of AI models.
All over the world.
All over the world, and delivering care. So I think that's really, really powerful and exciting.
Yeah, that's
but we're not there yet. And,
no, but it's within sight, kind
that's
of.
Right, that's
yeah,
right.
interesting. Andy.
So I think the best case scenario is that we end up not talking about AI at all. And by that I mean that it just is such a foundational piece of technology that it works on the back end in this way that you don't explicitly use. So my life and my interactions with the healthcare system are just more seamless, they're quicker, they're cheaper, and they're just better. And a good way to think about this is like the internet. So for those of us who are old enough to actually have used dial-up internet, it was this very intentional thing that you had to do. You had to go sit down at your computer, the modem would dial up, log on to AOL, and you would use it, and that's how you would use the internet. That's how we use AI now. Compare that with how we use the internet now. We don't talk about using the internet. My phone is connected. When I get in my car, I will push a button and it will connect to GPS and give me, routing around traffic to get me home in the quickest way possible. And so to me, that's the best case scenario for AI, where my life is just better and I'm not intentionally thinking about interacting with an AI. It's just the world is more reactive, it's more predictive, and I can actually focus on the things that I care about in a more seamless kind of way.
And so very briefly, can you project that onto public health?
I think that public health would be more reactive and predictive too. So it's a very labor-intensive process now to get lots of good information into the hands of people. Ideally, there would be an AI system that would automatically help us synthesize the vast amounts of evidence in the medical literature, real-time monitoring of like air quality conditions, sensors everywhere, and something that can pull that into a cohesive whole and give you very concrete, simple to follow advice in real time.
Yeah, like you'd still have to test the wastewater.
Yeah.
But you would be
still have to
getting the
measure
results.
things. You still have to measure things, but yeah, exactly. Yeah.
So,
I think primarily drug design will be
That's
revolutionized
good.
in personalized medicine. It will be true because of it.
so say I have a disease that has no known drug. How does that work?
Well, I think there are many ways of thinking about it. What's the cohort of people like you all around the world? What happened to them and what worked for them, what didn't work for them, assuming it can do a good match. So if it's a much more rare case, what are the other 3 cases in the world? And what happened to them, what the diagnosis, and again, what if you know the root cause, how to go and address it.
So we're at 1:30. We need to say goodbye to our live stream visitors. Thank you all for being here today and for your thoughtful comments that you've sent in. If you missed any part of the discussion, you can watch the recording on our YouTube page. Have a great afternoon, and we're going to keep talking here.